A lot of people have questions about how I swim with a central line. This video, I'm going to answer that. It's summertime in Australia. I've been doing a lot of swimming. When or if yourself or anyone you know gets a central line, number one rule is you can't swim and you can't get it wet. That is a policy in many places around the world. There's a reason for it. In saying all of that, there are studies that constantly come out and research done into central lines and how to maintain them. I know someone personally who never wore a dressing on their Hickman line. Their skin would react. No dressing on it for over a year and they never got an infection. If you can see the insertion site goes into the skin. The skin will naturally form and close around that tube. It kind of creates a seal. You go further up the line, obviously not touching it, I have sterile gloves. The extra line of defense in terms of bacteria going up. I've never been told that I was allowed to swim by any of my medical team or anybody ever. More of a personal choice, a risk that I myself am willing to take. I take precautions pre, during, and post swimming with my line to make sure that the dressing is fresh, but I keep an eye on it while I'm swimming and I just kind of make sure that the dressing stays intact. And then I also try and keep the lumens in that dressing as well. I don't do that all the time. Sometimes the lumens are out and I just create a seal around the skin. Honestly, it is just because I choose to and I feel comfortable to. It doesn't mean that everyone else does, and it doesn't mean that just because you see me out in the ocean swimming that you're friends with a line or you have a line or your child has a line. That doesn't mean that they can as well. Just make sure that after I've swum, I change the dressing straight away. I make sure everything is clean, everything is sterile. I love you all so much and I will see you soon.